This is the traffic going into Harley-Davidson of New Bern at 3:15, quarter to 3 in the afternoon. This is not rush hour traffic. This parking lot is what's here for the AFT bus, which is down at the Harley-Davidson shop way down yonder.
I turned up on people.
I'll be there, Mike. No, ma'am.
Check. 1, 2, 3, check, check, check. The people on the coast, we're just running out of all our stuff. This angry mob of white ring terrorists meets us in every place we go. We'll be back with you in just a couple of minutes.
All right. I will tell you there's something government can do. I'm here to tell you there is something government can do. You're stealing my points. Yes, government can get out of the way. Government can remove hurdles. Government can free up people with patient-centered solutions. And I'm going to give you several. And I'll tell you, some of these are kind of dry. But I'm not going to give you 1,000 pages to ignore because you're not members of Congress. Yeah, they don't read it, but we still got to obey it. All right, here's one. Allow people to purchase insurance across state lines. That will bring a lot more competition into the industry. It will give patients greater choice. Man, my lips are getting dry. Sorry, they're sticking together. Patients will get free. Yeah, Dallas has already stolen my doctor. We'll give people more choice. They will have more options, more freedom. This is a good thing. Another one would be have the government reduce the number of mandated benefits on insurance carriers. This will also free up the market. Insurers can decide what kind of benefits they want to give. Patients can decide among these insurers. Both of these people, both of these groups will be able to craft policies that reach people where they are and what they need. Another one would be individual ownership of insurance policies. This would allow people to get tax deductions. Tax deductions would flow to the individual, not to the employer. Also, the government should promote health savings accounts. Now, the government is worried about how to ration health care. Well, I'll tell you, 100 million single payers in this country, people will ration health care according to what's important to them. What you know is important to you, you'll make those decisions. It won't be one bureaucrat in Washington, D.C. who doesn't know you from Adam making decisions that are one size fits all for everybody. Here's another idea. Move the majority of Medicaid spending into simple vouchers so that the poor people can buy their own insurance. Here's why this would be great. It would cut out a lot of bureaucracy. Medicaid wouldn't have to try to police fraud. They're terrible at it anyway. We all know it. Even Obama has to say it. Let the private insurance companies police fraud themselves. They do a great job of it, much better than the federal government. And my last one, overall, which was already mentioned over here, is the John Edwards Cries one, tort reform. Here's one for North Carolina specifically, because North Carolina is one of the last few states in the nation that still has this. Who knows what a certificate of need law is? We got a few. Here's what a certificate of need is basically. If a hospital wants to add a new service, if they want to add new equipment, new medical equipment, if they want to add a new hospital bed, before they can do that, they've got to go to the state on their knees and beg and plead, please, Mr. Bureaucrat, can you let us do this? Because we know our business and this is necessary. And the state gets that decision. In my home county, Wake County, last year, they tried, 2 hospitals tried to open 3 separate satellite campuses to provide health insurance to growing places in Wake County. The other 2 areas still have to drive another 20-25 minutes out of their way to get health care. There's no reason for that. That's a Soviet system. It is not for the United States or North Carolina.
That's right.
So again, when you want to tattle on me to the Obama administration, my name is John J.O.N. Sanders. I'm with the John Locke Foundation, and I say, hands off my health care.
Thank you, and thank you all for coming out and showing so much support. We have got to keep this fight going because we are in a fight for our lives. We are in a fight for our children's lives. We are in the fight for unborn children's lives. And we have to keep this up, and thank you so much. Now I'm going to keep it very short and sweet. And I am here representing nurses and physicians. Are there any nurses, physicians, or any other healthcare professionals here? Wonderful. That is wonderful. Now, there are a lot of misstatements out there that some of our leaders in Washington are putting out. And they're saying things like nurses and doctors overwhelmingly support this Obama health care plan. And I am here to tell you that that is not true. That is a false statement. That is a lie. Okay? Now, the AMA a couple of months ago came out and said that they endorsed this health plan. But the truth is that only about 30, maybe less than 30% of physicians even belong to the American Medical Association. I talk to nurses all the time, and nurses are scared. Nurses are scared that they're not going to be able to take care of their patients in the future because of this. And we have to hold together. And what I'd like to ask you to do, continue to talk with your friends. Talk to your doctors. Talk to the nurses that take care of you. And hear what it is that they have to say. When you go to their office, they may not bring it up with you because you are there for health care and they are going to provide it to you regardless of how you feel. But if you bring it up with them, you will hear what they feel. Now my husband, I'm a registered nurse and I work with my husband. My husband is a general surgeon in Dallas. He came out on the tour for a little bit, but he had to go back and take care of patients and do surgery and heal people. As you see, doctors aren't going to come out in numbers because they're busy.